what to do and what not to do when it comes to anxiety and depression.
Well, I think there are so many things that I could say. I will say number one that just because something is common doesn't mean that it's normal or that it's something that you just have to endure. So I see a lot of
Mm,
people on social media, for example, who are saying,
yeah.
I have this mom rage and irritability, and I stay up all night watching my baby because I'm afraid something will happen while they're sleeping.
Mm.
Hi, this is the Care Room with Dr. Cindy. Welcome. It's a space that was created just for you. I'm your host, Dr. Cindy, and this is a chance to get up close and personal with me. We're going to talk about the things in medicine that matter to you. We'll talk about the questions you've been carrying. We're going to have some honest conversations. We're going to hold space for joy, struggles, and everything in between. It's care that goes beyond the exam room. Care you're going to take home with you, whether you're listening while you're driving or you're listening while you're exercising. I promise that it's going to be care that's rooted in truth and a deep commitment to walking with you every step of the way. I'm glad you're here.
Hi, everyone. Welcome, welcome, welcome. Welcome to another episode of the Care Room with Dr. Cindy. On this episode, I have a very exciting and special guest with us. It's Dr. Susan Zink. She's joining us from all the way in South Jersey, where she has her own private practice. But before we delve into things, I'm just going to let her introduce herself. It's all
Hello,
yours.
Dr. Cindy. Thank you. Thank you
Hi.
for having me. I'm so
Absolutely.
happy to be here talking with you. So, like you said, I am Dr. Susan Zink. I am a board certified adult psychiatrist. I have specialized training and expertise in reproductive and integrative psychiatry. And I have a private practice called EleMental Integrative Psychiatry here in South Jersey, in Linwood, New Jersey. Um, I focus on helping women, supporting women who have mood or anxiety or sleep problems that tend to occur during hormonal transitions during the reproductive lifespan. So, premenstrual symptoms, pregnancy, postpartum, and perimenopause. And my approach is integrative. So, I blend traditional psychiatric treatment like psychotherapy or referrals to psychotherapy and prescription psychiatric medicine with alternative holistic options, which can be things like lifestyle and nutrition optimization, sleep optimization, and evidence informed natural supplements and botanicals.
Absolutely. That sounds awesome.
Thank
Thank
you.
you for the work that you do. It's very needed, especially for the ladies that we serve. I know in my introduction, I should have mentioned that that is our audience. A lot of, women who are in different phases of life, and they absolutely, absolutely, absolutely need your services. So, Dr. Zink, can you tell us more about the postpartum period and what you see during that time frame?
Yes, absolutely. The postpartum period is a very common time for depression and anxiety to present themselves. About 20% of postpartum cases, we see depression and anxiety. And we say usually that the symptoms start within the first 3 months after delivery, but it's more like up to a year after delivery where we can see depression and anxiety coming up for women in the postpartum period. And it can
Mm.
look like typical depression and anxiety symptoms
Right.
where there might be some sadness and tearfulness, sleep changes, appetite disturbance, feelings of guilt or low self esteem. But
Mm.
there are some differences in the way that postpartum depression and anxiety can present compared to depression and anxiety in other times of life. So, irritability is a very common symptom of postpartum depression and anxiety. Some women refer to it as mom rage, where they just get
Yes.
really angry, and then they'll kind of
Yeah.
de-escalate. but it's really out of character and really bothersome, or not being
Mm.
able to sleep when the baby sleeps,
Yes.
difficulty bonding with the baby or responding to its needs.
Yeah.
And interestingly, we also see what we call intrusive thoughts happen.
Yeah.
And this can be a symptom of postpartum depression or anxiety or OCD, depending on what else is going on. But the thought is of harm coming to the baby, and this is not something that they want to happen, but something that they really fear happening. And these thoughts can happen. They're sort of normal when they happen once or twice. For example, a parent is walking down the stairs holding the baby, and they have the thought, "Oh my gosh, what if I dropped the baby while I'm walking down the stairs?" And then
Mm.
they kind of dismiss the thought and go on with their day, and it doesn't really come up again. But when these thoughts tend to happen repetitively, or they can't get them out of their head, or they're changing their behaviors so that they don't walk down the stairs anymore or don't do things because they're so worried, then that can be a symptom of a disorder that needs attention.
Sure, sure. And I know in med school we're taught about the postpartum blues, and there's like the one that kind of happens for a shorter period of time before the extended period. Do
Right.
you see a lot of those and women needing medication and help with that?
That's such a good question. Yeah, baby blues are very, very common. That occurs in about 80% of women postpartum, and it's considered to be normal
Yeah.
because it is most likely due to that huge drop in hormones that happens after delivery.
Mm.
And basically, women are more tearful or moody or um, sad, or they don't really know why, but these symptoms tend to resolve within 10 days to 2 weeks after delivery. And if those
Mm.
symptoms continue beyond 2 weeks and they last and they're persistent, that's when we consider more that it might be a postpartum depression.
Got it. Got it. And I know you mentioned um, you have a holistic approach.
Right.
Um, can you talk more about that in the postpartum or um, peri-pregnancy part of life?
Yes, absolutely. I think the holistic approach is important always in psychiatry and in medicine in general.
Agreed.
Um,
Agreed.
But really, especially in the postpartum period,
Mm.
medication can be helpful, but there are so many factors that go into postpartum depression, postpartum anxiety, having a baby. So, having support can be so important to prevent or help postpartum depression recover. Sleep optimization can be very helpful. So if you are not sleeping, if the baby is waking up every hour and that goes on for weeks, that can have a really big effect on the mood. And so
Mm.
sometimes I will write a prescription for the partner to say that you have to take sleep shifts. So maybe
Aw.
mom will sleep for the first 6 hours of the night, really 5 or 6 hours uninterrupted while the partner does the baby care. And then they
Mm.
switch, because having that uninterrupted sleep is much more restorative than having 6 hours of interrupted sleep. So that's one example.
Yeah, yeah, absolutely. That's awesome. I like that you include the partner as well.
Yeah,
'Cause I've had two, and the postpartum period is brutal,
right.
brutal. So I'm so glad that you do that. Can you talk to us about the perimenopausal part of life and what tends to is it anxiety and depression as well that you tend to see most?
Yep, absolutely. So, anxiety, depression, sleep disturbances are very, very common in perimenopause. That brain fog feeling, or
Right.
a lot of women will complain of word finding difficulty. They just can't concentrate as well. And perimenopause is a time when hormones are just really wildly fluctuating, and that can have a really big effect on the brain. We know that estrogen and progesterone are very active in the brain, and they are um, involved in the metabolism and synthesis of these neurotransmitters like serotonin and norepinephrine and dopamine that are involved in regulating mood and sleep and anxiety and temperature regulation. And so those are kind of all out of whack, and that can really affect
Mhm.
the mood and sleep. But also, this midlife tends to be a time when it's kind of a peak stressful time in many women's lives where they have kids that they're taking care of, and that might be younger children or it might be older children going off to college. They're kind of in the thick of a career often. And then sometimes also taking care of aging parents. And so when you combine all of those demands with the changes that are happening in the body too, that can really lead to a lot of mood symptoms around that time of life.
Yes, absolutely. I definitely agree. Definitely agree. Definitely. So, Dr. Zink, so um, for the patient listening, they're not sure. Sometimes I get, depressed or I feel sad. I get irritable. I yell at my kids. You know, I don't want to get out of bed, especially in the winter. How do you know when it's a problem?
That's such a great question and such an important question. So, first, I'll say everybody feels sad or anxious sometimes. It's normal
Mhm.
to have a range of emotions even throughout the
Mhm.
day. But
Mhm.
when the sadness or the anxiety persists for a long
Okay.
time, and when it's
Yes.
interfering with functioning, so if you are not doing well at work, or you're having relationship problems, or if you just feel kind of miserable a lot of the time for a long time, that's when we start to consider that it's a disorder and that it needs some more attention.
Sure, sure. And I agree with that. Myth busting, because I know in a lot of cultures and for a lot of people, it's a no-no for psych meds.
Mm,
I'm not crazy,
hmm
Why should I take that? And even in, like professional
hmm
um, uh, bodies, they tend to, even though they're recognizing certain signs, they tend not to want to go on meds because maybe, it will make me seem weak or not the professional that I should be. What would you say to those patients who are, I don't know about
Yeah,
meds?
hesitant about medicine. And that's
Yeah.
really common too. Um, Unfortunately, there's still a stigma. I think it's getting better, but there is still a stigma about psychiatric illness and treatment. And I think a lot of that has to do with sometimes the nebulous nature of mental health conditions. We don't have blood work, we don't have lab tests that can say this is what you have. Um,
Right.
but we do know a lot of science about depression and anxiety, and we have a lot of data to support that these are illnesses that are essentially illnesses of the brain, but more evidence that actually they're illnesses of the brain and the whole body. There's a very strong mind body connection, mind gut connection. And so I will say I don't often see patients who aren't interested in taking psychiatric medicine. Usually, by the time they come to me, they may be interested.
Yeah.
Although I do still see some patients who are hesitant to start a medicine. And I like to approach it by educating, saying that these are symptoms of a disorder and these are the potential treatments. Medication may or may not be indicated depending on the severity of the illness, but I will educate patients about what the possibilities are and the benefits of medicine or the risks of medicine, and tell them about the alternatives that they can try. And I will also just compare psychiatric medicine to medicines for physical illnesses. And I often like to use the comparison for asthma or diabetes. So, for example, if someone has asthma and they can't breathe when they run, I would tell them you would probably use an inhaler to help yourself breathe.
Right.
And this is kind of like the same thing, right? You don't have trouble breathing all the time, but sometimes you do, and this medicine is really helpful. Or the same thing, for example, for diabetes, you could try exercising and eating a really healthy diet. And that might be all you need to control your blood sugar well. But some people also need medications or they also need insulin. And it really just depends on the severity of the illness and how maybe non medication options are working.
Right, right. And that's, yeah, I think it's a constant struggle. I see it a lot on the
I'm
primary care
sure.
side. Um, yeah, so by the time we refer to you guys, we've already
Yep.
talked them. Usually, it's okay. This is what to expect. Do you do any like psychotherapy? Any like um, uh, ketamine or the any of those procedures or?
I don't personally use ketamine or any of the more interventional approaches myself. And there's always a little bit of psychotherapy when you're a psychiatrist. I do some psychotherapy. I think it's really part of a psychiatric appointment, but I also like to defer really deep psychotherapy to my therapy colleagues who have a lot of education and training in psychotherapy for people who really need maybe weekly sessions.
Sure, sure. Um, and for the married
Mhm.
couples, based on what you've seen, your experience, can you share any nuggets with us? Any words of wisdom?
Well,
Yeah.
I think it depends on the couple, certainly. I will really try to involve a partner if there is a even somewhat supportive partner, because especially in that postpartum period, um,
Yeah.
having support is absolutely crucial. And
Yeah.
there, I always tell my patients that annoying kind of cliche saying, "It takes a village." It's a saying because it's true. You really need a lot of support in the postpartum period, taking care of a baby and just taking care of children as they age too. So that's where I will try to recruit partners to help, like with the sleep shifts,
Yeah.
or taking care of the baby so mom can have a break, or having other family members that can help give both parents a break too.
Yeah, yeah. I tell you, having the help was clutch.
Hmm.
Like it was exactly what I needed to make it through that period.
Absolutely.
That is such an important part of things. Um, any other words of advice for us from what you see during your everyday work in terms of what to do and what not to do when it comes to anxiety and depression?
Well, I think there are so many things that I could say. I will say number one, that just because something is common doesn't mean that it's normal or that it's something that you just have to endure. So I see a lot of
Mm,
people on social media, for example, who are saying,
yeah.
I have this mom rage and irritability, and I stay up all night watching my baby because I'm afraid something will happen while they're sleeping.
Mm,
And of course, you're going to see a lot of women echo those experiences.
yeah.
And that's because they are very common, but that doesn't mean that they're normal and that you should have to go through it.
Mm. Absolutely. That's a good one. I love that. Not because it's common meaning that, like everyone is doing it, that it's
Right. Or
normal.
not deserving of
I really
attention.
mention. I love that. I love that. Dr. Zink, can you tell us where we can find you? Someone listening to you today, they like what they heard. They really want to chat with you some more or see you in the office, or find you on
Yes,
social media.
absolutely. Well, I have a website, elementalintegrativepsych.com, so you can find me there, especially if you're a woman struggling with anything that we talked about today, depression, anxiety, sleep problems. You can find out more about me and the services that I offer. And you can also schedule a pre-intake chat with me directly through my website. And I am also on social media, Instagram, Facebook, a little bit on LinkedIn. My handle on Instagram is Elemental Integrative Psych, and Facebook is Elemental Integrative Psychiatry.
Thank you. Thank you. And one more thing, Dr. Zink, I think we should probably speak to the mom or the lady who's listening, and they're at the end of their rope. they're having thoughts, about ending
Mm.
things. Um, can you speak to that person, provide any resources, and let them know that, what the next steps
Yes,
should be?
absolutely. And that's such a good point because those thoughts are also very common. And maternal suicide is one of the leading causes of death in the postpartum period. So it's very important. There are a lot of resources available and a lot of help available. So please reach out for help. There is, of course, the suicide hotline 988. Postpartum Support International or postpartum.net has a lot of really helpful resources too. Of course, you can always go to the emergency room. Absolutely tell a trusted partner or family member so that they can help you get the help that you need.
Absolutely. Thank you so much, Dr. Zink. Thank you, thank
Thank
you,
you.
thank you. Thank you for all you do
Oh,
for your
thank you.
patients. And thank you for being here with us. Guys, you heard from Dr. Zink. You heard where to find her. Her information will also be in the show notes, but definitely check her out. I will have another exciting guest for you next week as well. But until then, take care.
Thank you.
Goodbye.
Thanks for spending time in the care room today with Dr. Cindy. If you liked what you heard, please subscribe, share this podcast. I'm also on Facebook and Instagram. You can follow me there. Remember, you're not alone in this. There are doctors who do care. The information in this podcast is for educational and informational purposes only. It is not a substitute for professional medical advice, treatment, or diagnosis. Always, always consult your personalized healthcare provider for medical guidance.